What if I told you the steak you ate last night may not be the real reason you have agony today? Millions of people believe that gout is simply a disease of eating too much meat. Modern research is painting a different and bigger picture. The biggest drivers of uric acid today may actually be hidden in the sugars, in insulin resistance, dehydration, obesity, poor kidney functions, alcohol, and also an unhealthy metabolic system. Actually, you see a lot of raised uric acid in people with metabolic dysfunction, those who are not even taking alcohol, those who are not even eating red meat. So, if you have been treating gout attacks with painkillers while ignoring the root causes, what I've talked about, you may be fighting the symptoms instead of fixing the problem. In this video, I'm going to go beyond the medications and help you understand why uric acid crystals form, why inflammation suddenly explodes, and how nutrition and lifestyle can dramatically reduce the future flare-ups. What is uric acid? Uric acid is completely normal. Every day, your body breaks down compounds we call purines, and the purines come from your own cells, and then certain foods, and then also, it is also a process of the natural tissue turnover. So the liver converts the purines into uric acid. Normally, the kidneys will remove about 2/3, while the intestines remove the rest. The problem starts when you make too much or you can't remove enough. When the blood uric acid stays elevated, then tiny shaped needle-like crystals begin depositing inside your joints. The immune system sees these crystals as dangerous invaders, just like anything falling anywhere. And that becomes the inflammation, not the mild inflammation, but that massive inflammation. Why do these tiny crystals cause so much pain? Imagine having microscopic glass needles inside your joint. When the blood cells attack those crystals, they release inflammatory chemicals. And these include things like interleukin-1 beta, tumor necrosis factor alpha, and interleukin-6. Then the joints become swollen, it becomes red, it becomes hot, and it becomes extremely painful. This explains why patients describe gout as the worst pain they have ever experienced in their life. Let me break this myth for you. Myth number 1, red meat is the main cause. This is one of the oldest myths in medicine. While excessive organ meat and some seafoods are high in purines, most cases of gout today are driven by poor uric acid clearance, not excessive purine intake alone. Many people eat moderate amount of meat their entire lives and without ever developing gout. So what has changed? The modern diet. The biggest dietary trigger for increased uric acid that nobody talks about. You have heard me talk about fructose, and especially fructose from sugary drinks, the fruit juices, the sodas, the processed foods, the excessive sweets. Fructose rapidly consumes ATP inside the liver cells. This generates enormous amounts of uric acid. Unlike glucose, fructose directly stimulates uric acid production. This is why people who drink multiple sodas every day have significantly higher risk of gout. Alcohol, the double trouble. Beer is problematic because it contains purines and they raise uric acid production. They reduce the kidney excretion of the uric acid. And also alcohol dehydrates you. So spirits and excessive wine can also increase the flare risk, particularly when consumed in large amounts. Insulin resistance, this is one of the silent drivers, and I've seen in many of my patients. Here is where things become fascinating. High insulin levels tells your kidney, hold on more uric acid. That means higher insulin decreased uric acid secretion. High blood uric acid, more crystals. And then you have more crystals. This explains why gout commonly occurs alongside obesity, fatty liver, type 2 diabetes, hypertension, and metabolic syndrome. All those are markers of insulin resistance. And they are all connected. Dehydration. Many gout attacks happen after intense exercise without adequate fluids. During the hot weather, you are losing a lot of fluid. After illness, you lose a lot of fluid or you take less fluid. Less water means more concentrated uric acid, and the higher concentration increases the crystal formation. Ultra-processed food. Modern processed foods combine refined carbohydrates, high fructose corn syrup, excess calories, poor fiber, and high sodium. Together, they worsen insulin resistance and the metabolic dysfunction. The root cause, instead of asking, what medicine should I take? Ask yourself, why is my body not able to control the uric acid? And then you will know why. Because you know the answer is inside you. Let's see some of the strategies that you can use at your own level to control uric acid and prevent it getting overwhelming. Lose the excess body fat. Even losing 5 to 10% of your body weight improves uric acid metabolism. Eliminate sugary drinks. This may be one of the highest impact dietary changes. Replace soda with water, sparkling water, unsweetened tea, or coffee without sugar. Hydrate adequately. Aim for adequate fluid intake unless your physician has restricted your fluid. Hydration helps the kidney eliminate uric acid. Eat more whole foods. Focus on vegetables.